Our cats depend on us for everything, especially their well-being. Today, we're diving into the top 5 most common cat diseases, what they are, how to spot them, and how to prevent them. This isn't about fear, it's about giving you the tools to be a proactive, informed cat guardian. We'll cover everything from sneezes to serious conditions, with practical tips you can use right away. Grab a notebook, maybe a cup of tea, and let's get started. Your cat's health journey starts now. Let's dive in. First up, feline upper respiratory infections, or URIs. These are among the most common health issues that affect our feline friends, and understanding them is key to keeping your cat healthy and comfortable. Think of these as the cat version of a cold or flu. Just like people, cats can catch infections that make them feel under the weather, and these illnesses can spread quickly from one cat to another. URIs affect the nose, throat, and sinuses, making it hard for cats to breathe, smell, and even eat. The most common culprits are viruses like feline herpes virus and calicivirus, but bacteria such as Bordetella and Chlamydophila can also play a role. These germs invade the upper airways, causing inflammation and discomfort. They spread easily, especially in shelters, catteries, or multi-cat homes, through direct contact, sneezing, or even on your hands and clothes. A single sneeze can send thousands of infectious droplets into the air, and shared food bowls or bedding can also pass the infection along. Early signs? Sneezing, watery eyes, and mild lethargy are the first things you might notice. Your cat may seem a bit quieter than usual, or you might see them pawing at their face. As it worsens, you'll see thick nasal discharge, red or swollen eyes, loss of appetite, and sometimes fever. Some cats may develop ulcers in their mouths or on their tongues, making eating even more difficult. Cats rely heavily on their sense of smell to eat, so a blocked nose can quickly lead to weight loss and dehydration. If your cat stops eating for more than a day, it's important to seek veterinary care right away. Kittens, seniors, and cats with weak immune systems are at higher risk for complications like pneumonia. These vulnerable cats can become very sick very quickly and may need extra support to recover. Prevention is key. Keep vaccinations up to date, as core vaccines protect against the most common viral causes of URIs. Regular vet visits help catch problems early before they become serious. Clean food bowls and litter boxes regularly, as germs can linger on surfaces and spread between cats. Disinfecting toys, bedding, and other shared items is also a good habit. And reduce stress in your cat's environment. Stress weakens the immune system, making cats more likely to get sick or have more severe symptoms. Provide plenty of hiding spots, toys, and quiet time. If you bring home a new cat, quarantine them for a week or two to watch for symptoms before introducing them to your other cats. This simple step can prevent an outbreak in your home. Avoid overcrowding. Each cat needs their own space and resources. Overcrowding increases stress and the risk of disease transmission, so make sure every cat has access to food, water, and a litter box. Recap: URIs are common and contagious, but with good hygiene, vaccination, and stress management, you can keep your cat's airways clear and healthy. Being proactive is the best way to protect your furry family members. Stay alert for sneezing, discharge, and appetite loss. Early action makes all the difference. The sooner you notice symptoms, the sooner you can help your cat recover. A little prevention goes a long way. Simple steps like hand washing after handling other cats and keeping your cat indoors during outbreaks can help keep them safe. Keep your cat's environment clean and calm. Regular cleaning, fresh air, and a peaceful home all contribute to a stronger immune system and a happier cat. And remember, a healthy cat is a happy cat. When your cat feels good, you'll see more playfulness, affection, and curiosity. By staying informed and attentive, you can help your cat avoid URIs and enjoy a long, vibrant life. Let's move on to the next big threat. Now let's talk about feline leukemia virus, or FeLV, a retrovirus that weakens your cat's immune system and can have a profound impact on their overall health and quality of life. This virus is one of the most common infectious diseases in cats, and it's important for every cat owner to understand how it works and how to protect their feline friends. FeLV increases the risk of infections and cancer, making affected cats more vulnerable to illnesses that a healthy immune system would normally fight off. Over time, the virus can lead to severe complications, including anemia and lymphoma, which can be life-threatening if not managed properly. FeLV spreads mainly through saliva, so activities like mutual grooming, sharing food and water bowls, or even bite wounds during fights can transmit the virus from one cat to another. It's especially common in multi-cat households or outdoor environments where cats interact closely. The virus can also pass from a mother cat to her kittens, either before birth or through her milk while nursing. This makes it especially important to test and monitor breeding cats. FeLV doesn't survive long outside the body, so direct cat-to-cat contact is the main risk. Casual contact with contaminated surfaces is much less likely to spread the virus, but it's still wise to keep shared spaces clean. One of the challenges with FeLV is that infected cats may look perfectly healthy for months or even years while silently spreading the virus to others. This makes regular testing and vigilance essential, especially in homes with multiple cats. As the disease progresses, symptoms may appear gradually. These can include weight loss, a dull or rough coat, persistent fever, pale gums, and recurring infections that don't seem to go away. Some cats may also experience lethargy, swollen lymph nodes, or digestive issues. Testing is crucial. Every new cat or kitten should be tested for FeLV before joining your household, especially if you already have other cats. Early detection can help prevent the spread and allow for better management of the disease. Vaccination is available and highly recommended for at-risk cats, particularly those who go outdoors, live in multi-cat environments, or have unknown exposure histories. While the vaccine isn't 100% effective, it offers significant protection and peace of mind. The best prevention? Keep your cat indoors and limit their contact with unknown cats. Creating a safe, enriching indoor environment or a secure outdoor catio can help satisfy your cat's curiosity while minimizing risk. If you have both FeLV positive and negative cats, it's essential to separate them and use different bowls and litter boxes to prevent accidental transmission. Careful management can help all your cats live healthier lives. Awareness and responsible care are your best defense. Stay informed, observe your cats for any changes, and don't hesitate to consult your veterinarian if you have concerns. Test, vaccinate, and make informed choices about your cat's lifestyle. Regular veterinary checkups and open communication with your vet are key to keeping your feline family safe. With vigilance, you can protect your cat from this silent threat and ensure they enjoy a long, happy life by your side. Let's keep moving. Next up, 5. Feline Immunodeficiency virus, or FIV, is another retrovirus that weakens a cat's immune system, similar to HIV in humans, but only affects cats. 5 spreads mainly through deep bite wounds, so outdoor, unneutered males are most at risk. Unlike FeLV, FIV is rarely spread through casual contact or sharing bowls. Many FIV-positive cats live for years without symptoms, but as their immune system weakens, they become prone to infections, especially in the mouth, skin, and respiratory tract. Prevention starts with keeping your cat indoors and neutering to reduce fighting. Introduce new cats slowly to prevent aggression. Test any new cat before bringing them home, especially if they have a history of fighting. The 5 vaccine is controversial and not always recommended. Talk to your vet about what's best for your cat. 5 positive cats can live long, happy lives with good care. Regular vet visits, a healthy diet, and a stress-free indoor environment. Don't let an FIV diagnosis mean the end. Support and proactive care make all the difference. Next, let's talk about a growing concern: feline diabetes. Feline diabetes mellitus is becoming increasingly common in our beloved pets, and much of this rise can be traced back to the way our cats live today. Just like in people, changes in diet, less physical activity, and more time spent indoors have all contributed to this growing health concern. As our cats have become more a part of our families, their lifestyles have started to mirror our own, for better or worse. Diabetes in cats is a metabolic disorder, which means it affects how their bodies process food and energy. Specifically, either the pancreas doesn't produce enough insulin, or the body's cells can't use insulin properly. Insulin is a hormone that helps move sugar from the bloodstream into the cells, where it's used for energy. Without enough insulin, sugar builds up in the blood, leading to a range of health problems. The biggest risk factor for feline diabetes is obesity. Overweight cats are far more likely to develop this condition, but age also plays a role. Older cats are at higher risk. Inactivity, which is common in indoor cats and certain breeds like Burmese, can also increase the chances of developing diabetes. Early signs can be subtle, but it's important to watch for increased thirst, frequent urination, larger clumps in the litter box, and weight loss, even though your cat seems to have a healthy or even increased appetite. These symptoms can develop gradually, so it's easy to miss them at first. As the disease progresses, some cats may develop weakness in their hind legs, making it difficult for them to jump or walk normally. You might also notice their coat becoming dull, greasy, or unkempt, as diabetes can affect skin and fur health. If left untreated, diabetes can lead to a dangerous condition called diabetic ketoacidosis. This is a life-threatening emergency that requires immediate veterinary care. Cats may become extremely lethargic, vomit, or even collapse. The good news is that feline diabetes is manageable, and with early intervention, some cats can even go into remission. With the right care, many diabetic cats return to their playful, loving selves and enjoy a great quality of life. Prevention is always better than cure. Keeping your cat at a healthy weight is the most important step. Feed a high-protein, low-carbohydrate diet, control portion sizes, and make sure your cat gets daily play and exercise. Interactive toys and food puzzles can help keep your cat active and mentally stimulated. Wet food is often recommended over dry food for cats at risk of diabetes, as it helps with weight management and keeps blood sugar levels more stable. Always consult your vet before making major dietary changes. If your cat is diagnosed with diabetes, treatment usually involves daily insulin injections, changes to their diet, and regular monitoring of their blood sugar. Your veterinarian will guide you through the process and help you learn how to care for your diabetic cat at home. It may sound overwhelming at first, but with your vet's support, most owners quickly become comfortable with the routine. Many find that their bond with their cat grows even stronger through this shared experience. Remember, early detection is crucial. Don't ignore subtle changes in your cat's thirst, appetite, or litter box habits. Regular checkups and being observant at home can make all the difference. With commitment and proper care, diabetic cats can live long, happy, and fulfilling lives, bringing joy to their families for years to come. Next, let's talk about another important condition every cat owner should be aware of: kidney disease. Chronic kidney disease, or CKD, is very common in older cats. The kidneys filter waste, balance fluids, and regulate blood pressure. When they fail, the effects are widespread. Early signs are subtle increased thirst, more frequent urination, and weight loss. As CKD progresses, you may see poor appetite, vomiting, lethargy, bad breath, and a dull coat. Causes include age, genetics, toxins, dental disease, and high blood pressure. Regular vet checkups, especially for cats over 7, are vital for early detection. Blood and urine tests can catch CKD before symptoms appear. Prevention focuses on hydration, offer fresh water in multiple spots, use fountains, and feed wet food. Keep toxins and dangerous plants out of reach, and maintain good dental hygiene. If your cat is diagnosed, your vet will create a management plan, usually a special diet, medications, and sometimes fluid therapy. Early intervention and ongoing care can help your cat live comfortably for years, even with CKD. Stay alert to changes in drinking, urination, and appetite. These are your early warning signs. With love and vigilance, you can make a big difference. Understanding these common cat diseases empowers you to be a proactive, loving guardian. Early detection and prevention are your best tools. Don't wait for symptoms to get serious. Your veterinarian is your partner. Regular checkups and open communication are key. Trust your instincts and never hesitate to seek help if something seems off. Thank you for joining me today. Your cat is lucky to have you. Stay curious, stay caring, and keep those purrs coming. See you next time.